Hi everybody, Dr. Sarah here. We're talking today about neck and jaw pain, including TMJ pain, because a lot of us are familiar with the pain of a tension headache or the pain of holding your stress in your neck or clenching your teeth and jaw because you're stressed or even in your sleep. And unfortunately, we're seeing a real increase in these symptoms kind of across the board, which makes sense. But we're going to talk today a little bit about how you can manage that on your own at home. Because believe it or not, the first thing that you need to know is that stretching your neck might not actually be helping you. See, muscles are elastic, like a rubber band, so they're made to stretch, yes, but anyone who's ever tried to pick a shovel of something up where it was really far away from your body knows that the further away the weight is from the base of the lever, the heavier it feels. So when we have our heavy heads on top of our necks and we stretch out, that's actually putting a lot of strain and pressure into the muscles of our neck. Then we're asking them to relax into this really challenging position and then pick the head back up out of the stretch at the end. It just doesn't really work well. To add to that, the fact that muscles can shorten when they get tight, and so then when you try to stretch them out, you just end up tugging on something that literally can't stretch or give anymore, and that just aggravates the muscle rather than helping it relax. So instead, we're going to talk about what you can do to help it out safely. Now, the first thing that we are going to stretch out is our pec, believe it or not, because though we're talking about neck pain, the pec is hugely important in our upper body posture and the amount of pressure that goes into our neck. The pec or pectoralis muscle attaches from the top of your arm on the humerus to midline at the sternum. Now, the reason that we start with the pec is that when this muscle tightens and shortens, it pulls our shoulders in and automatically kinks the back of the neck here. That causes everything in the back to tighten into this position and everything in the front to tighten and shorten and sink down and in. This puts a lot of pressure in through the joints and muscles of the neck and causes a lot of pain and headaches. So we have to open up the shoulder if we want to resolve the posture and the neck muscles and the amount of pain that we have in the neck itself. Keeping in mind that the pec is a triangular muscle which runs from the shoulder to the sternum. To stretch it out, we're going to bring our arm to about a 90-degree bend at the elbow and shoulder, place our arm on a wall, and rotate our body away from it. It doesn't matter where my head goes here, the stretch comes from the body turning away. You should feel this in the front of the shoulder and nowhere else. If you feel it anywhere else, we might need to modify or adapt this stretch, or maybe stick to the tennis ball for now. Because those fibers are triangular in nature, some go directly across and some sweep down, broad at the base, narrow at the top. So you might change the angle of your arm to hit different parts of the muscle fiber. That stretch again from the back, we would put about 90 degrees into the elbow and shoulder and rotate the body away. The next muscles that we're going to stretch out are the scalene muscles. They're a group of 3 muscles on either side of the spine in the front. They run from just below your collarbone up into your neck, and they live just below the SCM in this triangle right here. Sometimes you can see them when you take a deep breath in. You'll get a little flash of a line of that muscle, but most of the time they're hard to see. So what you want to do there, though I'm not a huge fan of stretching the head off to the side, we can actually kind of look up and away and just sort of open up the front of the neck here. And that can take a lot of pressure, again, off of those muscles which get compressed when our posture starts to wither and shrink into a compressed state. And while I don't recommend stretching the upper trap, it is important to loosen it up because it can cause a lot of headache pain. So you can take a regular tennis ball and roll that along the upper trap. Sometimes I'll reinforce to help myself get to those spots and just sort of roll through that upper trap, rolling up to the base of the neck. You can do the same thing with the pec in the front, along the collarbone, down into that muscle to try to loosen up both of these muscles and take the pressure off. You could also lean on that tennis ball up against a wall and use it to work around and between the shoulder blades. This takes the pressure off of a lot of muscles that start in the neck and anchor into the upper back and shoulder and can really reduce neck pain and tightness. It's important to note that both ice and or heat can be appropriate in these cases, depending upon how you feel with ice versus heat and where the pain and tightness is. In general, you want to try to numb out pain and using ice for really painful things. And you want to think about melting away tightness and stiffness using heat on tight muscles. Sometimes those are one and the same in the neck, and so you might want to go back and forth between ice and heat or lean towards whichever one is most comfortable to you. But no matter what you do want to make sure that you're drinking lots of water. Always try to increase your water when you're having pain, unless you're drinking an absurd amount already. But most of us can stand to drink some extra water throughout the day. You will be amazed at how much elasticity comes from water. The more water you drink, the more supple your muscles are, the easier they are to move, the less restricted and adhesed to each other they become. So water is really important pain management skill, especially in neck pain and headaches. When it comes to the jaw specifically, we can apply heat or ice directly to the outside of the jaw. An ice pack or pack of peas can be really nice, gently to the jaw. Always important though to not put your ice directly on your skin. Or you can take a hot mug for some heat and press the mug to your jaw. Don't burn yourself, but let that moist heat soak into those muscles. Now that we've stretched and treated some of the larger muscles, we're going to focus on some of the smaller, sometimes trickier muscles.
When we look at the jaw, the main muscle that we chew with is called the masseter. The masseter is a triangular muscle that starts at the cheekbone and spreads down to the bottom of the jaw.
So again, the masseter muscle attaches from the cheekbone down to the jaw in a slightly triangular position. To treat the masseter, you're going to start with 3 fingertips on your cheekbone and then just drop slightly below. So you're just barely below the bone. What you'll do is you'll pull down and spread your fingers at the end. From the front, pull down and spread. At the end, if you're doing it properly, you should have a slight opening of your jaw. We're using a medium to firm pressure here. These are strong muscles, so pull and spread, just like that. We're going to also work on the muscle that lives just behind the jaw. So we'll be behind the jaw, just below the ear, using a forward pressure right here on this muscle, kind of following the angle of the jaw down and forward. I like to just hook my finger right there and draw down and forward along that muscle. This muscle here is digastric. It can be quite tender, and again, we're using about a medium pressure here, down and forward along the corner of the jaw.
Like the pec, the SCM, or sternocleidomastoid muscle, lies on the front of the body, and when it gets tight, it plays a huge role in pain in the neck, jaw, and head.
When we are massaging the SCM, we're going to start again with our finger pads and a fairly mild pressure right behind the jaw, kind of up under the ear, and you're just sort of going to pull down along that muscle, right through here. Pretty gentle. There's a lot of really important anatomy in the neck, and we don't want to crush any of it, but you can be fairly certain you're on that muscle. For that slow part, we're going to stay probably no lower than the chin, so we're just right here. I will say if there's anything that's particularly tender and doesn't feel good to press on it, don't press on it. It's fairly common sense, but I need to say it. Again, there's important anatomy here. If it doesn't feel good, don't do it. But for the SCM, a gentle pressure pulling massage is usually fine. And then you can find that muscle, you can tip and turn to make it pop out a little bit, and you can use a gentle pinching motion to massage the muscle itself. You should be fairly confident that you're on the muscle. You'd be able to tell. And you may find that it's tighter in one place on one side than it is on the other. I would always recommend treating both sides for all of these muscles. Even though you may have a headache or neck pain only on one side, that doesn't necessarily mean that that's where the problem is. So we're going to work both sides of the SCM gently and safely to help restore that pressure and take away some of the referred pain that that muscle can create. The last muscle that we're going to talk about is the pterygoid muscle. The pterygoid is a very deep muscle. It's actually on the inside of the jaw. But if we were going to touch it from the outside, we would come below the cheekbone and press up and in towards those back molars with this up and back pressure through here. You'll notice it starts to get quite tender, but to really get to the pterygoid, we actually have to go inside the jaw.
If we were to remove the jawbone, we would see that the pterygoid muscle lies behind the molars and runs to the inside of the mandible and the TMJ joint itself.
While incredibly important, the pterygoid is also very tender, so you need to approach this muscle with a lot of respect and caution. It's a very tight, very thin muscle, so a little bit of pressure will be very effective here. It tends to be very tender. In fact, the first person who practiced on me pushed way too hard when we were in chiropractic school, and I nearly bit them just out of reflex. So go easy. Less is more. And in general, with everything that I've shown you here today, you can always add more. You can't take away what's been done. So go easy on this one, particularly the pterygoid, because you could give yourself a headache if you really mashed on it. But on the flip side, you could really take a lot of pressure off and improve a lot of jaw pain and therefore a lot of neck pain because all of these muscles are so interrelated. Now, my favorite way to work on the pterygoid is actually in the shower. I let the warm water hit the outside of my cheek, I wash my hands, and I use my finger inside my mouth. We always use the opposite side because we're going to press up and back.
Use your pointer finger to slide along your teeth and try to touch the place where your jaw actually comes together. You'll find small, tender muscles there. You can press lightly with very gentle pressure and can stretch into the cheek as well. Always remember that if it's worth wearing gloves, it's worth taking them off properly. And always, always throw your used gloves in the trash.
Many of us could also benefit from neck stability exercises, especially those who struggle with posture. So, my two favorite exercises for that are this. The first is called neck retractions, but I like to call it the pigeon. So, you put your finger on your chin, and without looking up or down, you pull your head straight back like you're trying to make as many double chins as possible. Straight back and release. Back and release. And eventually you'll find that when you release, your finger doesn't touch your chin anymore. That's because you're stretching out the back of your neck and stabilizing your posture in a better alignment. Don't feel that you need to strain all the way back there. I've seen some people do some pretty funky things over the years. It's gentle, it's small, but after a while, it's effective. The next one that I like is called an isometric. Isometric means that the length of the muscle doesn't change at all. So these are exercises that we do without moving our body. They're incredibly good for stabilizing. So to do a neck isometric, we're going to push on our head very lightly, just enough to engage the neck muscles. If you are looking, it's barely enough to make my skin blanch, right? It's a very small amount of pressure. And we're going to push in the cardinal directions, but also the diagonals as well. It's about 2 seconds in each hold. So we're going to go around the head with a push, as if I'm trying to push myself over, but not letting my head move. So it's a resisted push to the front, resist this diagonal motion, resist straight to the side. Don't let me now, I'm pushing forward, but holding still, pushing straight to the back. Now to the diagonal side, straight to the side. You can see I'm shifting my head in but pushing and not letting myself move. Diagonal to the front. That's one circle. We would normally do 2 of these. These exercises can be done throughout your day. At most, you might do them 3 times a day, but honestly, once a day or once a week can be enough to just stabilize. It depends upon how acute you are. If things are really flared up, you're going to want to do those a little bit more. If you're just kind of maintaining good posture, you're not going to need to do them as often. Now, as with any of the information that I give you, the goal is never to make anything worse. So please check with your doctor or chiropractor before you begin any stretch routine to make sure that this is something that will help you and be beneficial, not harmful. None of these stretches or exercises here are the kind of thing that you need to grit and bear or tough through because they'll feel better tomorrow. That's not the name of our game here. We want to help, we want to give you information, and I just want to give you some options that you can try, adapt, work in, and see what works best for you. As always, if you have any questions at all, feel free to reach out to me. I am here and happy to help, and I hope that that's what we've been able to do today. Be well.